Now, what causes neck pain? There are many reasons. Yeah?
¿Cuáles son las causas del dolor del cuello? ¿No?
Remember, everybody will have a neck pain. The good thing about our profession, we never run out of work. Unless something is wrong with you.
Lo bueno es que siempre hay trabajo.
This head is about 4 kilo. Muscles, 33. Movement, 3,000 to 5,000 times a day. So with that numbers, there will come a problem.
Entonces el
So this is 4
el peso de la cabeza son 4 kilos
And this is 33 muscles around
y
the
los
neck.
muslos son 33 kilos.
Yeah.
Entonces ese movimiento diario va a causar dolor. ¿No?
And movements between 3,000 to 5,000 times every day, there will be a problem.
3,000 a 5,000 movimientos por día. Entonces ya es una receta para dolor.
Now, I discovered one thing, that most of everyone want to have neck massage. It's nice, yes. But it keep coming back, this pain.
Sí, un masaje del cervical es cómodo y lindo, pero no resuelve el problema. El paciente regresa siempre, pero no resuelve el dolor.
I have found out that on the herniation of the disc is 92% C5 and 6. Remember that number.
La herniación del disco, él ha encontrado que 92% es
Five and six.
C5 y C6.
Yeah. So those are commonplace. But the major cause of the neck problem is actually the junction between C7 and T1. If you can know how to take care of that place, you can get rid of all neck problems.
Entre C7 y T1 es donde encuentras la mayoría de los dolores y problemas de cuello. ¿No?
Now, question is why that C7 and T1 is because the head position should be this part, and the C7, it gives a different angle that the head is in the middle of the shoulder. But when you look down, that middle of the shoulder changes to T3, 4, and 5 balance. So this is where the pain will come from. Any pain here?
Entonces, cuando la persona está en una posición normal, está balanceado, pero cuando comienza a bajar la cabeza, la presión ya comienza a T1, ¿no? Y ahí es el problema del dolor.
Any pain here? Not much. How about this one? Yeah. This is 3. So you will always find the problem between C3 and C5, I mean T3 and T5. Because it's so common that when the neck is all the time looking down, the balance of the head will shift. Not in the neck anymore, but in the upper thorax area. So that's where everyone complains of pain. Pain here? Not much. But look at this, the same spot here. It's the same place, but one side it hurt more. So
even if the patient feels the pain in the neck, you have to work.
you have to work here. For me, there are times when I don't even touch the neck, unless you want to give a massage. But
When you push there,
yeah, exactly. See what is happening. When I'm pushing that place, I'm just irritating the place, but she's feeling pain in the neck.
yeah.
So when you go where the pain is, you never get it right. You need to find where it's coming from. And you see, all the time I'm pressing there because I'm irritating that trigger point.
Entonces tienes que, porque hay dolor del cuello, no
Yeah.
es necesariamente el raíz del dolor. Siempre tienes que encontrar dónde está el raíz y tratar el raíz.
So imagine if you spend time treating here, but actually the problem is there. So you don't get it. So in this case, I'm going to do this. See, my body weight is on her. So just this is the treatment. You don't need to do much anything. Do this. Again, it's quite easy because I don't have to work my back and work my fingers. No, I just put the weight on. That's it. Just give it a nice stretch. And this is quite easy to do by everybody. So learn to use your body weight. I've been doing this for so long, I can do 10 patients and I don't need a break. Each one 45 minutes. And I don't really need break. It's just my weight on her.
Usando el peso del cuerpo, él consigue hacer 10 pacientes sin tomar un descanso.
Breathe.
Es muy
Now we start again. But you see, this is how you go. into finding out where the pain is coming from. So, nice mobilization. Are you okay? It's painful? Yeah, it is. But you see, once you do this, the mechanical start, the blood circulation increase, oxygen increase, and pain decrease.
Cuando haces eso, la circulación de sangre mejora, la presencia de oxígeno mejora y el dolor comienza a desaparecer.
See, this pain you're experiencing is the ligament pain. It's very sharp and very intense pain.
De nuevo dolor de ligamento, ¿no?
Now, because she says she have neck pain, so let me show you how to work with the neck, if you have to work with the neck. So now, what I need you is slowly to turn around. Oh, no, stay there for a second, sorry. I'll show you one technique while she's still here. What can we do with the neck section of the bed? I need your hand to go here and there. Okay, this is really good now. How to get her neck, if you want to mobilize the neck while she's still in this position. So what I usually do, I'm going to free the lateral flexion head. So in this case, it's one machine which you have all the features, included the neck traction machine.
Entonces aquí tienes lumbar, torácico y ahora cervical con este movimiento del...
So what I do, I like to stand in this position and be in control of this part. So this is how I'm going to mobilize the neck. I just hold the position. Each thing, my thumb will be working on different mobilization of the neck. And this feels really good. So she's relaxed. I am using my body weight, and I'm also mobilizing her neck at the same time. So this is a very good technique, how to do the each segment. You hear that? Even click. So you don't need much force. So you can really get the manipulation and mobilization at the same time. So working on the muscles, it's nice, but doesn't fix the problem. You need to go deep into the structure. You have to comment. Tell her to comment and how it feels, because they need to know how she's feeling. Is it painful? Is it nice?
¿Cómo te sientes? Bien.
You
¿Hay
guys
un poco
missed
de
it.
dolor o no?
Do it on this hand. There you go. So this is really nice, how to mobilize the neck at the same time. And it feels good, it's so simple, it's so gentle, I don't need to use much energy, and so on. So this is one section of the neck. So we're going to go to another section of the neck. I need you slowly to turn around. Then we do it differently. Just be careful, you're too high up. So again, what can you do with the neck? Apart from the mobilization, you also can do traction of the neck. In the hospital, most of the time you have also a traction machine. Sometimes you do it manually and so on. So why don't we do it with this way? I'll show you how to do it with this. So I'm going to activate this neck traction. If you can go back a little bit. Yeah, that's good. That's okay. So again, one thing to remember, the neck has to be completely flat and also supported.
El cuello tiene que ser completamente plano y bien apoyado. Para
So you
poder
can see
hacer.
there is a space here. So I need to fill up this gap. It's okay.
Entonces, no quiere dejar un espacio
So in
entre el cuello.
So in
y
this case, her shoulders are more relaxed on this part. Her neck is totally supported in this part. So and then I know there is more safety first, and then also the way to work on it. So in this case, what I'm going to do, I'm going to activate this neck traction mechanism.
Es el mecanismo de tracción del cuello que se activa con un botón al otro.
So
al otro lado.
basically, remember when you're doing traction, you don't touch this place. You just don't do that. It's not comfortable.
No debes tocar el cuello cuando están haciendo
So
tracción.
you just,
del
I
cuello.
like to lock it up like this, hold it more like this, and then do nice traction, yeah, so like that, and then push it down. How do you feel when I do this? It's pulling. So this is how you do the traction. Again, I'm using my back and my body weight and pull and relax. So this is important to get more that you're going really straight down. But because I have ability to do this, I just have to make sure the chin is down and the neck is straight, and then you do the pull. It's important that your hands are not in her throat. So try to find how to keep this down together, and then you do a nice traction. So when this machine was built with idea to be able to cover as much as your spine treatments can be done.
Sí, la idea de la mesa fue para hacer un tratamiento completo de columna.
And then from this position again, I can also do the front part of the neck. Either you're massaging it or you're also mobilizing it. So I can just go into head again, hold it, and then start manual mobilization and so on. So this is when you go the front part. You can also massage it nicely with this position. It's quite comfortable actually, and if you have the right tool for it. That was the neck.